Hello, welcome to the PARS Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about the truth about what insomnia is and how to fix it. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. Feeling sleepy? You're not alone. On any given day, as many as 1 in 5 adults suffer from an insufficient amount of sleep. Can't sleep? If you struggle to fall asleep or stay asleep at night, it can take a huge toll on your health and well-being. Insomnia affects adolescents, adults, and the elderly. And as we age, sleep can become even more elusive, so developing good sleep habits when you're younger can pay off later in life. Many people think the term insomnia refers to a complete lack of sleep. In truth, insomnia encompasses a host of sleep problems, including difficulty falling asleep, waking up in the middle of the night, early morning awakening, non-restful sleep. Depending on your situation, the diagnosis of insomnia and the search for its cause may include physical exam. If the cause of insomnia is unknown, your doctor may do a physical exam to look for signs of medical problems that may be related to insomnia. Occasionally, a blood test may be done to check for thyroid problems or other conditions that may be associated with poor sleep. Sleep habits review. In addition to asking you sleep-related questions, your doctor may have you complete a questionnaire to determine your sleep-wake pattern and your level of daytime sleepiness. You may also be asked to keep a sleep diary for a couple of weeks. Sleep study. If the cause of your insomnia isn't clear, or you have signs of another sleep disorder, such as sleep apnea or restless leg syndrome, you may need to spend a night at a sleep center. Tests are done to monitor and record a variety of body activities while you sleep, including brain waves, breathing, heartbeat, eye movements, and body movements. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Common psychological and medical causes of insomnia. Sometimes, insomnia only lasts a few days and goes away on its own, especially when it is tied to an obvious temporary cause, such as stress over an upcoming presentation, a painful breakup, or jet lag. Other times, insomnia is stubbornly persistent. Chronic insomnia is usually tied to an underlying mental or physical issue. Anxiety, stress, and depression. These are some of the most common causes of chronic insomnia. Having difficulty sleeping can also make anxiety, stress, and depression symptoms worse. Other common emotional and psychological causes include anger, worry, grief, bipolar disorder, and trauma. Treating these underlying problems is essential to resolving your insomnia. Medical problems or illness. Many medical conditions and diseases can contribute to insomnia, including asthma, allergies, Parkinson's disease, hyperthyroidism, acid reflux, kidney disease, and cancer. Chronic pain is also a common cause of insomnia. Medications. Many prescription drugs can interfere with sleep, including antidepressants, stimulants for ADHD, corticosteroids, thyroid hormone, high blood pressure medications, and some contraceptives. Common over-the-counter culprits include cold and flu medications that contain alcohol, pain relievers that contain caffeine, Midol, Excedrin, diuretics, and slimming pills. Sleep disorders. Insomnia is itself a sleep disorder, but it can also be a symptom of other sleep disorders, including sleep apnea, restless leg syndrome, and circadian rhythm disturbances tied to jet lag or late-night shift work. Don't be a hero, the negative effects of insomnia. Ever heard someone brag that he or she only needs 6 hours of sleep? While it's admirable to try to put a positive spin on a negative situation, taking a heroic attitude toward sleeplessness can be bad for your health. Most people need between 7 and 9 hours of sleep. Getting insufficient sleep can cause fatigue, irritability, and excessive daytime sleepiness. Cause weight gain and make it difficult to lose weight. Weaken the immune system, making you more susceptible to getting sick. Cause elevated blood pressure, and can increase the risk of diabetes and heart disease. Contribute to chronic pain. Exacerbate mental illness, including depression and anxiety. Reduce focus and concentration, leading to decreased performance at work. Decrease motor function, making driving hazardous. If you are suffering from insomnia, there are many steps you can take to change your behaviors and lifestyle to help you get to sleep. Here are 10 tips for beating insomnia. 1. Keep regular sleep hours. Going to bed and getting up at roughly the same time every day will program your body to sleep better. Choose a time when you're likely to feel tired and sleepy. 2. Create a restful sleeping environment. Your bedroom should be a peaceful place for rest and sleep. Temperature, lighting, and noise should be controlled so that your bedroom environment helps you to fall and stay asleep. If you have a pet that sleeps in the room with you, consider moving it somewhere else if it often disturbs you in the night. 3. Make sure your bed is comfortable. It's difficult to get restful sleep on a mattress that's too soft or too hard, or a bed that's too small or old. 4. Exercise regularly. Moderate exercise regularly, such as swimming or walking, can help relieve some of the tension built up over the day. But make sure you do not do vigorous exercise, such as running or the gym, too close to bedtime, as it may keep you awake. Find out more about how to get active your way. 5. Cut down on caffeine. Cut down on the caffeine in tea, coffee, energy drinks, or colas, especially in the evening. Caffeine interferes with the process of falling asleep and also prevents deep sleep. Instead, have a warm, milky drink or herbal tea. 6. Do not overindulge. Too much food or alcohol, especially late at night, can interrupt your sleep patterns. Alcohol may help you to fall asleep initially, but it will disrupt your sleep later on in the night. 7. Do not smoke. Nicotine is a stimulant. People who smoke take longer to fall asleep, wake up more frequently, and often have more disrupted sleep. 8. Try to relax before going to bed. Have a warm bath, listen to quiet music, or do some gentle yoga to relax your mind and body. Your GP may be able to recommend a helpful relaxation CD. 9. Write away your worries. If you tend to lie in bed thinking about everything you have to do tomorrow, set aside time before bedtime to make plans for the next day. The aim is to avoid doing these things when you're in bed, trying to sleep. 10. If you cannot sleep, get up. If you cannot sleep, do not lie there worrying about it. Get up and do something you find relaxing until you feel sleepy again, then go back to bed. Make an appointment to see your GP if lack of sleep is persistent and it's affecting your daily life. Insomnia is the inability to fall asleep or stay asleep at night, resulting in unrefreshing or non-restorative sleep. And it's a very common problem, one that takes a toll on your energy, mood, and ability to function during the day. Chronic insomnia can even contribute to serious health problems. The good news is that most cases of insomnia can be cured with changes you can make on your own, without relying on sleep specialists or turning to prescription, or over-the-counter sleeping pills. By addressing the underlying causes, and making simple changes to your daily habits and sleep environment, you can put a stop to the frustration of insomnia, and finally, get a good night's sleep. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.